In May this year, the World Health Assembly adopted the world's first ever pandemic agreement, a new global pact aimed at improving how countries prevent, prepare for, and respond to pandemics.
And I look forward to your adoption of the agreement and to celebrating that adoption with you at tomorrow's high-level welcome.
Uganda, a WHO member state, must now decide what next. How can we use this agreement not just for the future threats, but for pandemics that are already here, like HIV?
What that means for Uganda is that you have rapid reporting. We are supposed to report on an outbreak that we have within 48 hours. But it also means that we need to ring-fence funding for cold chain and lab upgrades so that a district hospital can have the PCR machines, reliable power and staffing to be able to do samples locally instead of having to ship them elsewhere. But it also means that we have rapid access to vaccines and treatments under a PABS mechanism. PABS is pathogen access and benefit sharing, where if Uganda uploads the genomic sequence of a virus within 48 hours, it guarantees that the manufacturers will give us a slice of the vaccines and treatments when they become available.
Uganda has over 1.4 million people living with HIV, yet prevention efforts remain underfunded and overly dependent on donors. HIV may not cause lockdowns, but it is still a pandemic. The new pandemic agreement calls for a One Health approach, integrating human, animal, and environmental health, and emphasizes prevention before outbreak. This includes funding what we already know works for HIV.
COVID-19 taught us that if you have a pandemic that disrupts the HIV service provision, then you have consequences that you will be coping with long after the pandemic itself is done. For instance, if HIV testing stops because you have a lockdown, then you have people who could have started treatment who, if provision of HIV prevention services stops, or treatment for those who need daily care is stopped because of those response efforts, then you will have drug resistance several months if people are unable to get viral load tests. You have adverse effects months after the COVID-19 is passed. So, but on the flip side also, there is significant infrastructure that the HIV response already has. If you look at the lab capacity, you look at labs like the JCRC lab, which was initially funded as an HIV lab, having their capacity to pivot to test pathogens for the COVID like it did. There's so much that we can leverage on. If you look at the extensive community health networks that the HIV programs have.
Now, some of the investments that we are very proud to talk about is one, the laboratories. Uganda has a laboratory system that goes down up to the communities. We are able to station mobile laboratories anywhere in the country. And these mobile laboratories are level 3 laboratories where we can test any pathogens that are of the viral hemorrhagic fever series. Let us not forget the antimicrobial resistance. We also have sentinel sites monitoring this because it is also another potential for outbreaks.
The recommendations for Uganda under the pandemic agreement include following WHO treaty processes and localizing it, restoring domestic HIV prevention funding, educating the public on the agreement, integrating HIV in emergency preparedness, and leveraging existing initiatives like the fast-track presidential plan.
The government just need to up the game and plan with the Minister of Health to ensure that this department of disease surveillance is well funded and is functioning, not to wait for external funding like it has been the case. In fact,
if you look at our national health policy, it already caters for a bit of the funding, but more for when there is an outbreak. We would probably need to update it so that it captures preparedness element so that we have specific funding for pandemic preparedness.
From Ebola to COVID-19, Uganda has lived through outbreaks. But what if the next pandemic is already here? Slow, silent, but deadly. The pandemic agreement gives Uganda a fresh chance, not just to react to the next emergency, but to prevent it, including the one we've faced for decades. Walter Mwesije, NTV.